Hello there, Patterson Stark here, and I'd like to talk about cancer and fasting, and all the different facets of fasting, and what they do to the presentation of cancer, the prevention of cancer, and the treatment of cancer, and the efficacy of cancer therapies. Now, it's a big topic, and I don't expect to cover it all by any means, but I want you to hang in there with me to get a few important concepts out of the way. Number one is that fasting is a natural phenomenon. When we get nauseous, our body doesn't want us to eat. And by doing that, it's allowing our immune system to heighten itself and take care of the immediate circumstance. So if we get nauseous from chemotherapy, or if we get nauseous from a virus, or we get nauseous from a heavy meal, it's the same message the body's giving us: stop eating. And why does it do that? Physiologically, Dr. Walter Longo and his group have found that the mechanisms that the body uses during a fasting state radically increase the immune system's functionality. And it does that in two folds: by clearing out old dead debris through a process called autophagy, and secondarily by allowing each cell to turn on its genetic system of survival to improve the mechanisms of antioxidant production. And that protects our tissues. That protects us from infection and the noxious things of that, and also protects us from cancer by producing a better immune system response. And when we refeed, when we're hungry again, we get a proliferation of stem cells and a burst of new healthy cells. Now, cancer doesn't like to have its food supply interrupted, and it likes to live in a low oxygen, highly sugarized environment, and it lives off of that, and it will take more than its share to do its job and make another generation of unending cancer cells. As the body loses hold of its immune system's ability to take care of cancer when it sees it, cancer gets a foothold, and through a process of inflammation, spreads. And that spreading inflammatory process is what the problem is. We are in a pro-inflammatory environment dietarily: too much processed food, too little fiber, too little antioxidants in our system, and we eat for 15 and a half hours a day. That's the average. We eat 6 meals a day. We weren't designed to do that. And when we look at countries that do a little bit more towards the natural side of eating 2 or 3 meals a day, we find that their cancer rates drop right off. So there's the first clue. And we use fasting with cancer in a preventative sense, in the saying that populations who have a fasting routine, who maintain a normal body weight, who undereat more than they overeat, generally have less cancer of all kinds. Now, that's a pretty good statement, but what about when you have cancer? Is there a place for fasting? It becomes much more critical and much more of a specialty. And we need to understand is that this is where we need supervision by somebody trained in the ability of the body to take care of itself when undergoing A, cancer treatment, and B, trying to maintain a cancer remission. And those are two separate issues, but it's an important topic. What is the right frequency? What about intermittent fasting 2 times a week, or once a month, or after your chemotherapy or before your chemotherapy? What about time-restricted feeding? How many hours a day should you be eating? These are all topics that we like to work on in our masterclass, and I believe that they're most important. I have a lot of experience with this. I've seen scores of patients over the years, myself included, as a cancer survivor, and I know that the immune system picks up when it's integrated with a whole foods fasting mimicking diet or a water fast. Alan Goldhammer at the True North Center in California has successfully fasted people with lymphoma and put them into complete remission, and sometimes cured them of all tumor mass. This is an interesting thing, and so it comes back to the basic physiology. Cancer, when we don't feed cancer, and we don't feed the body as many calories, and we don't feed it as often, the immune system has the ability to go and tear down the ineffective cells to make a better immune system and protect itself in case we're going through chemotherapy, going through radiation, going through surgery, and we repair much better with much less damage to the native tissue and more damage to the disorganized, poorly organized cancer cells. And that's what the research is showing. So come to our masterclass, learn the basics of this physiology, even if you don't have cancer, of course, which we hope you don't. You can learn how to be on the preventative side, going from our number 2 killer to far off in the distance and joining those countries like Cambodia and Vietnam, where cancer is very rare, and it's primarily because they're active and they have a plant-based diet. It's not that simple, but it can be. So I hope you join us. I look forward to seeing you there. Bye-bye.